Welcome, everybody. I am Kathy Silberman. I'm with Academic Alliances here at ASU, and today we're really excited to have the College of Health Solutions here, whole team, to share information that will hopefully help you support your students who are transferring to ASU, considering transferring to ASU in College of Health Solutions, and I will allow them to introduce themselves as they get started, but let's go ahead and kick it off.
Wonderful. Thank you, Kathy. Good afternoon. Good morning. I guess it's still morning. Good morning, all. My name is Dr. Ron Hicks. I am the Executive Director within the College of Health Solutions Student Success Hub. What does that mean? It's our hub that deals with all of our student-facing areas within the college here itself, from recruitment all the way through their graduate studies and everything in between. And at the College of Health Solutions is a unique college. We were founded in 2012. We're the only college of its kind across the country. And our focus is to creating those health solutions, to create those leaders who reimagine health in a better way. And not necessarily by going in and doing the research in the hospitals and saying, okay, here's how you solve this, but how do we keep you out of the hospital? How do we work with those? And so that's kind of our area that we focus on. Next slide. Our mission is to translate health research and discovery into practice. So as to fit right in with the ASU mission is really to find useful public research and put it into play right away so that we are figuring out how to solve those issues that our communities, our world are facing in the health space. We have a lot of our medical degrees within the College of Health Solutions, non-nursing, so that's one of the things. The team that you're going to see some of today, this is our team. I am the executive director of this group. But we have Nikki Bonnet, who's our director of the recruitment, is on here, and Kiri Studebaker, who's our director of academic services and oversees all of our undergraduate advising. But we have a director of community engagement and retention who's yet to be hired. And we have Raylyn Clausen. She's not here today, but she is part of our team and does community placements, because one of the things is all of our students in the College of Health Solutions are required to do some type of experiential learning, some type of hands-on touching throughout their experience. What does that mean? When I talked earlier about the vision and the goal, and our mission is really addressing the health challenges in 3 areas of focus. We focus on the systems of healthcare and how the needs of our population. So it looks at our food and our audiology. We work on health performance of the individual across the lifespan, from infancy all the way up through aging, and looking at those opportunities through our speech and hearing sciences clinics and understanding the speech pathology, those type of things. But we look at the performance, and then we also personalize health interventions through personalized precision health, such as wearables, and understanding how those can impact our health and what does that look like. Our clinical exercise science programs looks at our, hooking up the breathing machines onto our treadmill. So really is a focus of across all 3 of these areas is our systems of healthcare, human performance, and the precision health throughout their lifespan. Back one, two up. There you go. Our areas of focus that we really hit on is obviously behavioral health is one. We have as people go through, we have a doctoral behavioral health. Blue zones are a unique area that has recently come into play. Netflix has created a Blue Zone video. If you've not seen it, it's fascinating. And ASU College of Health Solutions has partnered with this to put together a course for some of our students. And it really talks about where are those zones where people are living to 100 plus and living and thriving in those areas. We're doing a lot of work with cancer research and diagnostics, health equity. We do a lot with our indigenous population in rural Arizona and across the country. We are focusing on heat and health and how does that impact our population, and what are those ways that we can impact and lower the health impacts of the heat as we continue to live in this urban heat island and our climate continues to change. Human performance, nutrition, food and nutrition is huge, and every day we're learning more about those and what those looks like. That precision health I talked about earlier of how does that look with our movements and everything. And then also we do a lot with our veterans health and military affiliated families of looking at that and that support network through that health population. Next slide. We have a lot of community partnerships throughout the Valley. I'm not going to list all of these, but we do a couple of them that I'll highlight. We work very closely with the Mayo Clinic. We have built a building that is right next to the Mayo Hospital up in the North Phoenix area. A lot of our students are going and working in Mayo clinics and working in those areas. We work with Phoenix Children's Hospital. Creighton University, we have some consortium agreements where students will go in and they can move right into a degree, their master's and or doctorate through Creighton University. So this list continues to grow and grow because we're trying to figure out ways to continue to partner in the area, in the health space throughout the Valley. Next slide. I'll turn it over to Kiri for the next part.
So the College of Health Solutions is unique in the fact that we do offer degree programs across all 4 of the Metro Phoenix campuses. So you will see us everywhere throughout the Valley, not only on those ASU campuses, but as Ron mentioned, we do have a partnership with the Mayo Clinic. So we have a Health Future Center over in North Phoenix, where a lot of our students and faculty are participating in research across the different areas, especially biomedical informatics. We also have a huge presence with online degree programs. So a lot of our students do choose to participate in campus immersion programs. However, we have a large population of students who are choosing now to go into our online degree programs. So we've been expanding those extensively in order to meet that need. You will also find us at the ASU California Center. So if you do have any students who are living in the LA area that are either moving or coming from, they also have that option as well. Next slide. Thank you. So a little bit about our college by the numbers. Who are we? Kind of refer to ourselves as a Goldilocks college. So we're not one of the largest colleges at ASU, but we're also not one of the smaller colleges. So these are our enrollment numbers from this past academic year. So fall 2023, our incoming class, we had over 6,900 students, and over 5,900 of those were undergraduates. So students who may have been coming in as transfer students, students who were coming in as freshmen from high school, coming in to complete their bachelor's degree program. Over 1,000 students are our graduate students, or students who are pursuing our master's or our doctoral programs. And 46% of our undergraduates that came in, as I mentioned, we have a large online population. So 46% of that 6,900 students are completely online. They've never stepped foot on our campuses. 28% of our fall 2023 incoming class, go back, thank you, were transfer students. So just so you all know, we get a larger population. We're hoping for more coming in from the community colleges, realizing that they have goals and hopes in health and healthcare. And we are the place to go to if they have those desires. This past year, we just had over 1,900 degrees granted. Next week is our convocation, and we're super excited because we're going to be adding to this number. So one of our biggest joys is getting to see those students cross that convocation stage. So we are gearing up for that next week, and this number shall change. So these are our undergraduate degree programs. Ron mentioned that we are one of the first of its kind as a college. And really what that means is we're really taking an interdisciplinary approach to health and healthcare. So you're going to see from this list of undergraduate degree programs that they really run the gambit of where we are participating in those areas. So everything from public health to dietetics, nutrition, biomedical informatics, sports science performance programming, medical studies. They really run the different areas and different focuses. But we really take an interdisciplinary approach to make sure that all of these areas are working together, because when they go on to whatever their healthcare career goal is, they're going to be working together to help with patient care, to work in those hospital settings, those clinic settings. So we want to make sure that they are really well-rounded as a healthcare student. You're going to notice next to each of these degree programs that have little letters in white, those indicate what campus at ASU in the Metro Phoenix area those degree programs are offered. So the little D is our downtown Phoenix campus. P is our Polytechnic campus in Mesa Gilbert. U is our West Valley campus over in Glendale. And the T, there's only one T, that's our Speech and Hearing Science program. That is the only degree program that our college offers at the Tempe campus. So very important to know as you're working with your students. So many of your students that you will be working with may have hopes, desires, aspirations to go into a professional degree. So an MD, a DO, a PA, dental, maybe they want to be a pharmacist. We have so many different degree programs that can help them with them. Two of them I do want to highlight are our medical studies and our health sciences program. These bachelor's of science degree programs are really specialized to give those options for students. So you're going to see if you ever pull up the curriculum for our medical studies or health sciences, medical studies has all of those prerequisites those students will need to go into whatever professional pathway they want to go into. So making sure they're taking all their science prereqs, but then also giving those additional courses in their junior, senior year for both health sciences and medical studies to really get used to what is healthcare going to be like? What is our healthcare system like right now, currently? What could we do to improve it later on? What does the global healthcare systems look like? How do we differ? How do we look at health disparities overall? And how do we work on professionalism in the healthcare setting? So really getting those courses that's going to set them apart and make sure they have that experience when they go into that professional world. In addition to their degree program, go back, thank you. We also have pre-health advising on all 4 of the campuses in the Metro Phoenix area. So in addition to their academic advisor, we have pre-health advising that really focuses on those pre-professional programs. So looking at, not only how am I doing with the courses that I need to take as prerequisites, but what does that application process look like? It's completely different for a PA program versus a medical MD or DO school. So what does it take to get into those schools? What does that process look like? And who can help me with, creating a resume, making sure I've got a personal statement that's going to blow the admissions committee out of the water? Or how do I get recommendation letters from my faculty? Pre-health advising is really here to help your students through that process. So we actually have a pre-health advising in our office in the College of Health Solutions. So our assistant director, Ryan Van, he is our assistant director of pre-health, and him and his team really strive to meet with all of our students to make sure they've got that additional information they may need if they're interested in moving on. So maybe your students don't want to go to a professional school. Maybe they don't want to go on to become a medical doctor or a pharmacist. Maybe they want to continue on with their degree program and go into a master's program or a doctoral program. We actually have a lot of accelerated degree programs, or what were lovingly called previously 4+1 programs. So here listed is all of our 4+1 or accelerated degree programs that you can take a look at for your students. A lot of them specialize to make sure that they're getting that hands-on practical experience to move forward into whatever their careers are. So whether they want to go into global management with our Thunderbird School of Global Management, or they want to go into healthcare administration and policy and go on into Thunderbird, or maybe they're a biomedical informatics student. They're really interested in data science, how we're using that data science to impact healthcare, and they want to go into our MS of biomedical informatics. We have so many different options for them. So make sure if you are working with your students and they are curious about that type of degree program, that they're completing their bachelor's in 4 years and they're getting their master's in 1 extra year, this is a great opportunity for them. And every single degree program within the College of Health Solutions requires what we lovingly call experiential learning. So it's a required 3 credit hour class that the student can kind of customize to whatever their goals are, their hopes are, whether it's getting involved in research, whether it's getting involved in internships, whether it's getting involved in something hands-on, so volunteering, something like that. They're all required to get involved in some way to help ensure that their resume has that impact that they're going to need for those future jobs. So we have tons of partners, as Ron alluded to in our previous slide, that we work with. And a lot of them we work with specifically for internship opportunities for our students, not only clinical internships, but non-clinical as well. So making sure that they're getting that experience hands-on to put on their resumes. And we encourage our students from day one, their freshman year through all the way through. So even as your undergraduate students are maybe coming in as sophomore, juniors, they can start from day one, getting involved with research. So many of our faculty within the College of Health Solutions are doing practical research throughout their weeks that our undergraduate students can actually just reach out and start getting involved. So there's so many different things that we're setting to make sure that we're getting into impacting our local and global community. And not only are they getting involved with internships, research, but a lot of our classes are taught by experts in the healthcare field. So professionals, we have doctors teaching our courses, we have chiropractors, we have MD, DOs teaching classes. This is just some of the list of some of the classes that some of your students may take, especially in medical studies, health science, sports science, performance programming, nutrition, that they're going to take that are going to get those impacts from those faculty who are in the actual areas of health that can make sure that they're getting connected to people that they'll need in the future, as well as getting that education they're going to need to make that impact for themselves. And we have just a lovely video. It's one thing if I can talk about the student experience, but it's another thing to hear it from actual students themselves. So we have this video to kind of share a little bit more about the student experience.
I am reducing barriers to good health.
I am making a difference for people and communities.
I am putting my passion to work.
I am the future of health. I am translating scientific discovery into solutions that change lives.
At ASU's College of Health Solutions, our students learn to help people live healthier from birth throughout their lifespan. Because we know the health challenges we face are vast, complex, and connected, and solving them will require people from all different backgrounds. As a student, you'll be part of the only health college of its kind. At the most innovative university in the nation, you will make good health happen through real-world learning, clinical experience, internships, and scientific research.
I would say to any incoming students, the most important thing that I learned is ASU is a super diverse campus. Having those different perspectives and being able to learn from one another in those aspects has been super beneficial and important for me.
My biggest advice, I'd probably say two things. I'd say one is get to know your professors. They kind of follow you throughout your undergraduate experience.
They really want to help you be successful. They want you to enjoy your program. They want you to get the most out of it.
Those connections with your professors made it seem like a lot less of an intimidating environment, and it really gave you community. Also, just to take advantage of the opportunities that ASU offers you as a campus and as a whole.
You have to jump on them and take them and really dip your toe in a lot of different things.
I think that ASU especially provides so many routes that we're constantly innovating, finding best practices, finding new ways to research. That innovation mixed with just the purpose behind what you're doing, I think will propel me. And it's a cool concept being able to think that I can one day make a difference in even an individual's life and help them with their health journey. And that's something I really look forward to, and that's why I want to continue studying what I study.
Be part of the fundamental shift from healthcare to health, from illness to wellness, from diagnosis and treatment to prevention and intervention, sustaining the mental, social, emotional, and physical health of individuals and communities. You are the future of health, and the future of health is here. ASU's College of Health Solutions.
Hi everyone, my name is Nikki Bonnet and I oversee our student recruitment efforts for the College of Health Solutions. And as you can see here, we have a team that can help with early outreach, high school students who are thinking about what program is right for them, and transfer students. So it is likely that any of your students who are interested in one of our Health Solutions programs will interact with one of our team members. So this is our group, and I know this will be shared, so you will have our contact information emails below, so feel free to reach out to us. But we do have one graduate recruiter, we have one outreach coordinator, and then we have 3 undergraduate recruiters on our team. Next slide, please. Something I should mention too is each of our team members has a territory, so we kind of share the responsibilities. So whether you're in the East Valley, the West Valley, if you're in Central Phoenix, we've got someone who can probably meet you on campus. If not, I thought these were some important things that as students, specifically transfer students transferring to ASU into a College of Health Solutions program. We have a wonderful transfer admission website that I always encourage students to visit. It does a great job of outlining, like, here's all the steps you need to take. Here's what you need for those steps. Here's how you complete them to complete the application with ASU. It also has some important dates, deadlines, and next steps. So please feel free to share that with students. I do all the time. If you want to look at some more specific dates, like an academic calendar, or when do our semesters start? What does it mean to be an A, B, or C session? And the dates and deadlines box, that is our academic calendar. And I did share the full links so that you guys, just in case, so you could copy paste them if you need to, but you should be able to click on them. But those are great ways to see, like, when should I really be applying? I know when my team and I work with transfer transfer students, a lot of times they're like, I need to get my semester done and then I'm going to apply, when really you could apply 6 to 12 months ahead of time and start planning earlier. Not always the most convenient for transfer students, so it's also okay if they want to apply now to start in August, but it's nice to have that academic calendar so they can start to see, like, when is tuition and fees due, or when can I get a refund if I change my mind, or when should I really be applying by. Then something that's pretty unique about ASU is we constantly host visits and events for students looking to visit campus, learn about the colleges and the program, the resources that we have. Each campus is very distinct in the culture that it has. No two are the same. So sometimes it's nice to just kind of get your feet on campus, visit some of the different campuses and see what's the right fit for me. You know, some of our degrees like health sciences, they're offered on more than one campus. Some of our degrees are only offered on one campus. So if you have the luxury knowing that, like, oh, I'm health sciences, but I don't know which campus, come talk to us, reach out to my team or visit us. They're year round. We do them weekly. There's lots to choose from. So I did include our visit us schedule so you could see what dates we have coming up. This will always be, so you can use it in the fall and the spring. But also, if none of those dates work, it's totally fine to reach out to my team and we can do like a one-on-one sit down, talk with the student about their interests, where they're at, and show them around campus as well. But you will, every Monday and Friday on every campus, we are hosting events, and we do things in between too, but you should have lots of time and selection to see what works for your schedule. Next slide, please. Kiri and Ron talked a little bit about our student makeup, and so I pulled some information. So of those percentage of students that were transfer student, these are the degrees that they enrolled in for the fall 2023 semester. So you can see a large group was our health sciences major. Another large group was our speech and hearing science. So those are the two most popular degrees that our transfer students enrolled in for fall 23. But you can also see a lot of them in movement sciences and nutrition, population health, and our healthcare delivery programs. So you can kind of see there's a pretty good spread are growing in transfer students. So we hopefully look forward to continuing that trend. Next slide, please. Transfer students always ask about how to pay, financial aid. I wanted to include some information for you to see and to share with your students as you talk with them about transfer scholarships. So ASU has a scholarship search. So it's like a one search, and you go in, you fill in the details, you customize through the filters. I do tell people, take some time, play with the filters, because sometimes we'll put it in the way we think, and you might not get any results, but then the next week you tweak one thing and there's like lots of results. So this is a living, breathing portal. We're always adding to it. So you can look at it now to get an idea of what's going to be maybe this time next year. I do recommend like checking it in the fall, just maybe once a month to kind of get familiar. Utilize it. If you have questions, again, please feel free to reach out to us. I'm happy to sit down with someone and kind of walk through and how to use it. And then I also wanted to highlight a couple of our scholarships that are very specific to transfer students. We have the Transfer Achievement Award, and the basic qualifiers for that are we're looking for AZ residents who transfer to ASU from one of our Arizona community colleges, 3.5 minimum cumulative GPA. They need to demonstrate financial need, so they need a FAFSA on file for that. It's not an application. When the student applies to ASU, if they meet that criteria, they will automatically be considered for that and notified if they are awarded in their financial aid award. That's one of the benefits of applying earlier rather than later, is ASU has that time, and we still have a pool of money that as students apply, it's kind of first come, first serve. So we look at that pool and then we start to award as we have funds left. So one of the big benefits is you don't even have to do an extra application. By merely applying to ASU, if you fall into those criteria, you're automatically going to be considered for an application. There's also the link there if you want to learn more about it. And please note that these are the criteria for this year. They generally stay the same, but each year they might tweak just ever so slightly. So I do recommend that when it comes time for your students to apply, just take a look, make sure they've got the most up-to-date information. If anything's confusing, reach out to us. We're happy to clarify, but we do a really good job at ASU of keeping our websites up to date for that reason. And then the one underneath that, the David Corey Brecker Scholarship, this is actually a College of Health Solutions scholarship. It is Also, we're trying to award transfer students. So it is for Arizona residents, again, who transfer to ASU from an Arizona community college. You need to be a CHS major. So when you apply, you need to be prepared to apply for a CHS major. 3.0 cum GPA, demonstrating financial needs. So again, they'll need to have that FAFSA on file. That one, we're actually accepting applications through June for the fall 2024 start. So if you have students you know who are thinking about coming to ASU, more specifically the College of Health Solutions, this might be a good scholarship for them to apply to. And I put the link there for you as well to reference, and also to share with your students should they be interested. Next slide, please. I think that was kind of all we had for the College of Health Solutions. So we have our website and our contact information there, in addition to the direct contact info, but we'd love to hear from you. Questions, concerns, visits, classroom visits, whatever you want. We're happy to help. Thanks for your time today.
Thanks, Nikki, Carrie, and Ron. So I'm going to, before you go, and while you're thinking over questions for CHS, I'd like to share a little bit of information about my path to ASU. So in addition to the resources that you use with your students to keep them on track for their associate's degrees and preparing for transfer, and then also, of course, in addition to the support that you just heard about from the College of Health Solutions before they even leave the community colleges, we would hope that you would also encourage your students to sign up for My Path to ASU so that they have a clear pathway into the major of their choice at ASU. Students will save time and money overall by being on My Path to ASU because they're following a customized course by course and term by term pathway. And so that minimizes any potential loss of transfer credit by taking courses, or from taking courses that they wouldn't need for their program, unless, of course, they choose to for whatever other reasons. They can track their progress all along the way using that pathway and what's called My Transfer Guide. And then they receive a big benefit is that they receive these personalized communications from us, the right information at the right time because of our partnership and because of the way we see when they sign up for their pathway, and also when they plan to come to ASU. We know what kind of information that they'll need at every stage along the way while they're still working with you. We want them to stay with you and maximize their transfer credit, of course, and hopefully earn their associate's degree with you as well. But this way they're in touch with ASU. They have contact information. They feel connected. They know when we're having some events that they can come to, either online or in person, like those tours that everybody just mentioned. They also can talk to our transfer coordinators and our transfer student ambassadors all along the way, and they get guaranteed admissions into the program of their choice when they meet all of the pathway requirements. This isn't a shortcut. It's basically like take what you need to, and also, complete your associate's degree, your AJAC if you're in Arizona, and if you meet the admission requirements, then you're in. But it's all in a centralized resource with My Path to ASU. And then any additional admission requirements are listed out at the top. So it's a really nice, handy way to summarize those requirements for your students so they know that they're taking what they need to for their associate's degree and bachelor's degree. In case some of you have not seen My Path to ASU, I wanted to show you a really quick video on how it works and how easy it is to use. And this is what you can use if you're working with transfer students. You don't have to sign up for an account just to be able to access the information to share with them. All right, so the big URL to remember is asu.edu/mypath-to-ASU. That's what we hope that you'll bookmark if you haven't already, because that leads you into being able to see My Path to ASU pathways for exploring, advising, counseling, depending on where you are, all of that. And then also it leads you into the sign up if you're a student. And so when students are ready to sign up, and that really should be when they're first even considering transferring to ASU, we hope that they'll sign up so that they're connected and get all of the information they need. If they decide to transfer elsewhere, no harm done. It's free, and we don't contact them forever. They do fall off of the communication after a little bit. So we know, and we just want to know that they're connected and have that information at their disposal and are aware of the benefits. So students who are outside of Maricopa community colleges would go to this page. And actually, even if students from Maricopa go to this page, it's going to route them to the right place as well. But you can start on the left side is Get Started with My Path to ASU. That's the link to sign up. On the right side, search My Path to ASU majors. Those are kind of small, so that's what they look like. And when a student types in where they're going to the community college, if they're going out of state or outside of Maricopa in Arizona, let's say Pima Community College, or up north at Mojave Community College, then it's going to lead them through the sign-up steps. And then Maricopa also has a landing page of its own, because Maricopa has so many different colleges and we have so many transfer students coming from the Maricopa community colleges. So we hope you're aware of this page as well. And those two buttons, again, wording's a little bit different. It's sign up on the left, and then the My Path to ASU Majors is the exploration button. You all probably have clicked on it thousands of times, honestly. And those steps are over on the right. We also have hard copy flyers in our office. If you'd like any of those, please reach out to me at Kathy Silberman or Kathy.Silberman@asu.edu. We can send some over, or have your transfer coordinator or transfer student ambassador drop those off. And before I turn it back over to the College of Health Solutions, I just wanted to mention that, as many of you know, ASU is going through some changes in general studies requirements. And so we know that looking at the pathways right now might give you a lot of questions, because you see general studies gold and general studies maroon. And so just know that, please know that the Academic Transfer Credit Solutions team is working really, really hard to fill in those equivalencies as we make that transition. We do recommend that you use the class search at tcg.edu, that stands for Transfer Credit Guide, to look up individual classes if you have any doubts about how something will transfer, and if it's a maroon general studies, which is the current set of requirements, or the gold, which is the incoming, starting with the fall of 24. So, and also if you have any questions, always you can reach out to me and I can connect you with the right people regarding general studies. But as we receive more information, we'll make sure to offer some trainings on that for you all. And so with that, I would like to open it up to questions for the College of Health Solutions. And I'm going to go in and unmute you all. Sorry about that. Not great with multitasking. So you can also, if you'd rather not talk, or if I haven't clicked on your allow to talk button yet, you can type it into the chat or the Q&A. Well, I think the College of Health Solutions team did a wonderful job, and I don't see questions at this time. But as we've all said, we'll go ahead and send you a copy of this presentation, because there's so many helpful links in it. So I'll send it to everybody who has attended. It'll also be on the Academic Alliance's website, the My Path to ASU transfer training videos section, which we often share that URL with you. I don't have it memorized, but we will always put that in our communications with you so that you can go back and also share it with your colleagues. So we'll let you get back to the rest of your day. Thank you so much for coming today. We hope that the rest of the semester goes great for everybody. Thanks to the College of Health Solutions too for sharing all of this helpful information.